I want to tell you about a patient. The patient is Kevin. He's real. He's 15 years old. And Kevin, when he was 2 years old, had a catastrophic problem. A portion of his small intestine lost its blood supply. And so at age 2, his small intestine was removed. That's a part of the bowel that absorbs nutrition from food. Kevin now suffers from what's called short gut syndrome in pediatrics. It's a euphonious name. He has too little bowel to sustain his own growth and his own health. And so for 13 years, from age 2 to age 15, Kevin has been fed in part by a special intravenous tube, a catheter that stays in his veins, and special fluids are put in to give him calories. 9 times in 13 years, that intravenous tube has gotten blocked or infected. It's very hard to maintain access to the blood supply in a patient for this purpose. And when it becomes blocked or infected, the tube must be replaced surgically. When I met Kevin, he was in the hospital for the 10th time to replace the tube. And at the time I'm speaking of, no one, not Kevin, not me, not his surgeon, yet knew if a suitable vein could be found for a new tube. The stakes were very high, and Kevin knew it. My medical students asked me a question which led me to Kevin. They said, "Can you help us understand the life of a child with chronic illness?" The people who come into our systems of education are prepared to think systemically. So we asked Kevin, the expert. I went to him and I said to him, "Kevin, would you do me a favor? Write down on a sheet of paper the answer to 2 questions. When things go great, what is it like for you? What is great for you? And what's a defect? When we fail, how do we fail?" This is what he wrote.